Presenting to you a 60-year-old doctor who was a father of one of my friends came to the OPD. I saw his eye, dilated exam showed small pupil, grade 3 cataract, fibrillar material of pseudoexfoliation syndrome on the anterior capsule. The patient had high expectations. The patient wanted to drive, the patient wanted to do all his near work, which went against my decisions of implanting a multifocal IUL. The patient is an avid driver, drives around 2 or 3 hours every day. So I planned an EDOF lens for this patient. The patient was eventually he went on to become a VIP patient for me with high expectations on my shoulders. And yes, just like that, there are some hidden burdens on your shoulders when you're operating cases like these. I give a meticulous brainstorming sessions in myself to decide what's best for this patient. So right now I'll make some quick decision makings, and as you will see, we'll start the case now. Creating a side port. From the start of the case, you should know how meticulous planning takes charge of a good surgical result. I have not created these side ports in the limbal location. They are 2 mm anterior to the limbus for the sole purpose of making my job easy, to decrease the chances of iris prolapse, to decrease the chances of posterior pressure, and all these small pupil cases, pseudoexfoliation syndromes, iris atrophic cases. I make it a point to make these anteriorly located side ports and the main port. Yes, in the capsule like that, I'm constantly talking to the patient to reassure him. He had a little anxiety. And yes, one more burden that lied on my shoulders was that the patient wanted a video of his eye while I was operating. I have decided an extended depth of focus IUL for this patient. Considering he was a driver, I did not want to subject him to glares and halos at night. For those multifocal IULs which have rings on them, I wanted to play safe. I discussed all the options. A transparent discussion with the patient is always good. I discussed all the pros and cons of the patient, and the patient wanted that he should get an EDOF IUL instead of a multifocal, which would eventually lead him to lead a happy life with a good intermediate vision, because the patient also used to operate his cell phones and a laptop. I have completed a 5 millimeters of capsular excess. Mind you, there are unhidden burdens, unhidden expectations on a surgeon's shoulders. Needless to mention, you have high hopes. This patient had come to me um, after getting a lot of consultations from other doctors as well. I was the sixth doctor this patient took the consultation from. He liked the way I talk, and yes, a high EQ comes handy in cases like these. You should always be transparent and talk to your patient. Give those extra 10 minutes for these patients who are anxious about getting their eyes operated. The factors that go against me are that I am 31 years old. I look pretty young for my age, and people have troubles trusting me because of my young age. But yes, you should show your skills, you should show your knowledge and gain the confidence of patients like these. I have dialed the nucleus. The rexus is beautifully central, and we'll go ahead with the phaco part. Phaco part is critical. I want to establish and throw some good vertical cracks using the vertical chopping technique. I've asked my OT assistant to keep all the IULs in standby just in case I happen to rupture the PCR. It's always good to have a standby IUL in VIP patients. And I'm going deep inside, and I've used a dialer instead of a chopper. Not got a good crack, but it's still okay. I can see these chalky lens fibers in the endonucleus. I'm aiming for them for a good grip. I have kept a vacuum of 430 millimeters of mercury, and getting a good grip for a good crack is important. Once I have got 4 quadrants, the job is half done. The victory is mine. I'm sorry for this decentered camera view. I was a little shaky in my moves because yes, the patient is a doctor, is a well-renowned doctor of the city, and eventually he will see this video. Yes. But yes, being a surgeon, you should know how to calm your nerves. I am really meticulous and keeping my phaco in the center of the eye, filling the anterior chamber with good viscoelastic because the patient is elderly and we want to save every millimeter square of endothelium that I can save in this patient. So giving a good viscoat on the endothelium, going ahead with the heminuclei that is left, and here you go. The case is going pretty well. I am happy with my progress. The patient is being constantly encouraged for looking into the light, especially these anxious patients. You should always reward them with positive feedback cues that you are talking to, and that way the patient knows that they are coordinating well with the case. And we are down to the last piece. I'm holding my nerves strong, and yes, it's a happy day. Now that you know the nucleus is gone, the easiest part is looking up. I'm going to go ahead with a good IND. I have these decent pair of irrigation aspiration cannulas with a sandblasted tip for a good polishing experience, just in case if I have a PC plaque or some fibrillar material on the posterior capsule. The patient had 70% of the pupillary dilation, has pseudoexfoliation syndrome, grade 3 cataract, and high expectations. Very, very high expectations. We are down to the last cortical fibers. At this stage, my OT assistant is just loading a Hoya Vivinix Impress lens that is fairly recent IUL. Technology has gone leaps forward. This lens has a central zone which makes the patient able to read intermediate distances fairly well. I have seen good results with this IUL. Yes, it has a yellow filter. It's a good IUL for even patients who are at risk of ARMD and CNVM, blocking those UV radiations from the sun. That's why the patient had just accepted my offer to get an EDOF lens instead of a multifocal. That's all from my side. It was a fun, a beautiful case with multiple complicating factors, with those unsaid burdens and baggages on your shoulders. Sometimes you need to show your metal, what you're made of. My friend was really happy. His dad was happy as well. The patient got 6/6 and a good intermediate vision. And that's all from my side. I hope you like my stuff. Kindly like, share, and subscribe. Thank you.